Thank you, Governor. Good afternoon. As usual, we'll start with data. The Governor shared our case count for today, which is 275 new cases. We've seen a decrease in the number of cases we've announced for the last few days. This has much more to do with variables like the holiday on Sunday and the weather yesterday, as opposed to a decrease in the amount of the disease we are testing for and evaluating in Rhode Island. We want to continue to encourage primary care providers. Thank you. Continue to accelerate getting as many people with symptoms tested as possible. And everyone still knows that they can go to cvs.com to also go online to get testing done as well if you have symptoms. So we will continue to be aggressive with capturing as many members of our population who have symptoms as possible, including those who are not able to make it to the drive-through sites and who live in various communities, either in the urban setting or are homebound. We definitely have you in mind or wanting to make sure that accessible testing is available for you as well. So to sadly go into a little bit more about the 7 fatalities that the governor referenced, there were 2 people in their 60s, 2 people in their 70s, and 3 people in their 80s. Our hearts and condolences go out to those families. Of these 7 people, 3 people were residents at nursing homes. In addition to these 3 people, there was 1 fatality which was associated with a residential home for people with differing abilities. This person was in their 70s. Sadly, that is the 2nd fatality associated with that facility for people with differing abilities. We've been asked a few times about why I sometimes name at the press conferences the facilities where we have seen fatalities and why we sometimes don't. We want to make it clear that we have that information, and upon asking, I can certainly share when we have clusters of cases or, unfortunately, clusters of deaths that have occurred at a particular facility. Oftentimes, with the timing of this press conference, we're looking to give the facilities and the associated families time to process, a very challenging situation. So that's why I have not been actively volunteering that information, really wanting to offer support for the facilities and the families involved. But for the media, we do have that information if asked, and we can also provide it in our press releases that are issued later in the evening to allow for some of that time to occur. Separately, as a follow-up to what the governor discussed about the masking executive order using cloth face coverings, I want to remind everyone that the cloth face coverings we are talking about need to cover the nose and the mouth. Your covering can be made of a variety of materials. It could be sewn by hand or improvised from household items such as scarves or t-shirts, or if you have a young baby with a bunch of clothing that has Velcro in it, you can use that in a creative way to make a mask. There are all types of possibilities to make face cloth coverings, with the point being to be able to cover your nose and your mouth, and have the primary role of this be to reduce the release of infectious particles into the air when someone speaks, coughs, or sneezes. As the governor accurately stated, covering your nose and mouth helps to protect the people around you from being exposed. We are trying to limit the spread of respiratory droplets when people are in the community, when they're working, and when people are in public. These droplets that can be sprayed without a covering can oftentimes land on things, which is why we talk about the importance of being able to clean high-touch surfaces. Wearing a face cloth covering allows for less of that to be released into the environment. It's a good idea to wash your face cloth covering frequently, ideally after each use, and at a minimum, at least daily. It's also important to know, do not share your face cloth coverings with other people. Although this executive order is about customer-facing businesses, this same practice of wearing a face cloth covering is strongly recommended for all critical infrastructure workers. That includes law enforcement, people in manufacturing, people who work in water and wastewater infrastructures, and many others who are critical to the work that's occurring. Our executive order focuses on customer-facing businesses. I want to reiterate, if you want assistance as a business or as a staff person working there and getting support with face cloth coverings, you can go to the Commerce website. It is actually commerceri.com. So that is the updated version of that website that you can go to get the information. One other point I want to make on cloth face coverings is while they are very important, the governor has been great about emphasizing this, these coverings are not replacements for doing the evidence-based and proven social distancing that we're talking about, washing your hands regularly or using hand sanitizer, and absolutely staying home when you are sick. You should not be using a cloth face covering as a reason to go out into the community with symptoms. It is not acceptable and it's not effective to do that. These are critical prevention measures that must be done together, and the social distancing, the hand washing, and staying home if you're ill must continue. Lastly, I want to reiterate the message about not going to the doctor or going to the hospital without calling first. We have been partnering very closely with all of the hospitals and providers throughout the state. They have let us know that they are still seeing a lot of people showing up without calling at their facilities. They've also let us know that a sizable portion of those people are people who do not speak English. So we are working hard to get the word out. Again, with this messaging, we ask that you help us with that. We want to make sure it's available in English and in Spanish, and certainly be able to reach the other languages as well. People need to call their doctors if there is a concern before just showing up. Your doctors will help in determining whether or not a call to a hospital needs to be done. We want to make sure that people receive the care that they need, but we need to do it safely and help protect the healthcare workers who are on the front lines and our Rhode Island heroes out there taking care of patients every day. Another option for everyone to be aware of is the respiratory clinics that we have set up throughout Rhode Island. These are urgent care centers and primary care providers that have established a separate space specifically to see patients who may have COVID-19. They are equipped with the personal protective equipment that they need so that they can do it safely. There are roughly 20 respiratory clinics throughout the state of Rhode Island. So that's also an option for people to be able to call to set up an appointment. No one should be just showing up. We have a link to a list with phone numbers on our English and Spanish web pages for these respiratory clinics. The best thing to do is to go to our website, health.ri.gov, and you can either click on the COVID-19 banner that's on the front page and then click the testing tab, Or you can click the En Español button on the health.ri.gov homepage, then look for testing or pruebas. Even for these places, anywhere that you go as a healthcare facility, provider, a respiratory clinic, an urgent care center, or the hospital, all of those places need a phone call before going, a phone call first, and not just showing up.